The Department of Health has raised serious concerns over the alarming rise in lifestyle diseases. Briefing the media on the department's plans to address the non-communicable diseases, the Deputy Health Minister said diabetes is the leading cause of death in the country. All right, for more on that discussion, the Deputy Minister joins us now, Dr. Phaahla. Deputy Minister, good to have you, and thank you very much for your time. Alarming statistic that you're giving us that now non-communicable diseases, this is your cardiovascular diseases, this is diabetes-related diseases, even some malignancies, are beginning to cover a large part of the cause of death in the country, even surpassing the COVID-19 pandemic. Now, considering that these are preventable lifestyle diseases, what is possibly going wrong?
Well, several things are going wrong. Amongst others is the fact that I mean, there are positive issues in as far as the fact that South Africans are generally, living longer, but at the same time, it means that with modernization, which makes it possible, with access to amenities, access to clean water, access to, various amenities, which makes it possible, including health, access to health services. But at the same time, with modernization, it's, we're moving further and further away from more natural food, especially. So it's food in terms of just what we eat, but it's also, as we know, with modernization, more and more people spend time, either what we call sedentary kind of habits, most of the time sitting in transport, watching movies. Nowadays also it's not much as movies, but also, playing on our gadgets, both young and old, especially the younger generation, with less and less physical activity. And then also the third aspect, which is also habits in terms of consumption of things which are not helpful. Yes. Increased consumption of alcohol, for instance, it's well documented in this country. Exposure to things like smoking, now even more complicated, because it's not just the traditional cigarette smoking, but through all sorts of e-cigarettes, vaping, all those things are combining to complicate our lives in terms of non-communicable diseases.
Now, has there been sustained public action, programs, policies, practices that would have been tested and used rigorously to prevent, what we call behavioral diseases or lifestyle diseases?
There has been a lot of work over time, but I think what we must acknowledge also, and which is part of the kind of seminar which we're having today, is part and parcel of bringing together a number of experiences, reports also from researchers, and also people on the ground in communities to see what works and what has not worked. I mean, we all know that the advent of the COVID-19 pandemic did put some pressure on some of the programs, both in the communicable diseases, in terms of campaigns, messages, public messages, including also, as we've also been recovering from some of the other what has become chronic illnesses on the infectious side. Diseases like HIV and AIDS, tuberculosis, as some of those. So as we are recovering from the lost ground in terms of work which has actually previously gained momentum before the pandemic, we accept the fact that we need to reinvigorate also campaigns and messages around non-communicable diseases.
Yeah, so health education, you're saying, is central, is a central component, health education and communication. But programs, largely based around health education alone, it seems, according to some, maybe you can say anecdotal research, has not been really able to produce the kind of significant improvement that we would like to see.
Well, the problem with that also is that, I mean, across the board, whether we talk about family planning, whether we talk about HIV, sexually transmitted infections and all that, and the non-communicable disease is also even more difficult in terms of campaigns and communication, because the modes of communication, what people, listen to and what people believe also keeps changing. So we also acknowledge the fact that we need to move with the times. I mean, the kind of methods of communication which would have been efficient a number of years ago, whether it's in terms of, I mean, buying space in print media, magazines, and so on, still has a place. But, people nowadays spend more and more time on their gadgets. There's TikTok, there's all sorts of various social media platforms, which we need to move with the times, influencers, some of whom. So you need to be able also, and this is part of what we're trying to also adjust to, the fact that, I mean, the issue of person to person, for instance, in our case, as we're reporting today, making use of community health workers who live in the communities, but also bringing also traditional health practitioners, because interesting that while there's been all this modernization, large number of people still believe in traditional health.
Yes.
I mean, you see even sometimes it's almost like modern, fashionable for young people to also get into being sangomas and all that. So those are, you've got to balance modern kind of means of communication, but also using the kind of areas and beliefs through which people, still find them quite influential. And that's what we are reviewing to improve our reach and impact on the society.
There's about 4 legs to my own thinking right now. I'm sure you've got much more. One of them you've already mentioned: promote public support and community capacity. But one which you've mentioned earlier on would have been of great success during the COVID-19 period was more public policies, 1, but 2, funding. I mean, we were getting new regulations every single day that made, of course, the conversation to remain current, because people needed to know, what does that mean? There's a new law. Where must I go? Where can't I go? And that type of thing. It's something that we do not have around these non-communicable diseases. But 2, obviously, a lot of money, we have to be honest, would have been put into the COVID-19 fight at the time.
Well, definitely, the difficulty with, epidemics and pandemics, such as, your diabetes, your high blood pressure, cancers, and so on, is because these are slow killers, silent, as we call them, silent killers. So they don't create the hype that immediately. And the sort of, in a way, while it was quite a very difficult situation, the COVID caused a lot of quick anxiety, because, somebody would be well today, you would have met somebody, and few days down the line, the first time you hear that something is wrong, that person has passed away. Whereas these ones are very silent and very slow. So it's not very easy to create the same kind of hype, but we need to be creative. And of course, in terms of also mobilizing funds, because this COVID was just too disruptive in social life, economic life, sports and recreation, everything was disrupted. Whereas again, these ones are sort of silent and slow. So we need to be more creative funding-wise. I mean, that's why we were saying even today that the levy, the health levy, which we leverage through sugar enforced drinks, that what is generally called a sugar tax.
Yes.
We need to put a lot more use of resources like those, including also the sin taxes. We need to be creative with our treasury colleagues to make sure when those kind of taxes also help in overall coffers of the country. They must also be plowed back into improving quality of life and making sure people are much more aware and much more better educated in preventing these non-communicable diseases.
Can we talk about that a little bit more? I mean, the sugary drinks companies, are they not just merely absorbing, just swallowing the tax, even the sin tax, the companies that make tobacco and alcohol, they just pass it on to the consumers? Do they really feel the pain?
Well, I think until such time that we are able to get the message across, I mean, at the current moment, if you look at, I mean, whether the sin taxes on tobacco and alcohol, it doesn't, I mean, you know, other interventions, if you look at, for instance, on smoking, the prohibition on smoking indoors, advertising and such interventions in the early years had significant impact, where we found that the prevalence of smoking would drop somewhere in the region of between 10 and 15%. But, you know, with time, as those messages almost like get dull, people get used, those companies just adjust and are able to still able to market their products. Similarly, in as far as the taxes on alcohol, you're correct in the sense that they simply just pass them on, and that's why also we are looking at within the alcohol. I mean, on the tobacco and electronic delivery systems, you are aware of the new bill which we have revived in Parliament to move in with the times in terms of the new systems, but also working with other partners, social development. We are also looking at new interventions in terms of reducing the clamor in as far as advertising of alcohol is concerned, because we are aware that, I mean, you know, up to a certain level, the interventions which are there, it's very easy for the industry to simply just adjust and be able to still be able to attract, especially the young people.
I heard murmurs at some point, but I don't know how serious that particular conversation went, where there was talk of, for example, fast food companies reformulating product in how, for example, certain offerings are made, how much salt is put in there, and so on and so forth. This has been tried elsewhere in some other parts of the world. I don't know whether it's something that we believe in South Africa. Certainly we can do. Even in some instances, they speak about changing portion sizes that are being sold by food companies.
We do have regulations. I mean, over and above the levy on sugary drinks, we also do have legislation, for instance, in terms of prepared food, especially, you know, the pre-prepared, pre-packaged food, especially your snacks, for instance, the levels of salt which is allowed. It's also regulated to try and make sure that individuals don't consume something in the region of more than 5 grams of salt, you know, per day. But also in the area of saturated fat, we also do have regulations. But we do acknowledge at the same time that in terms of making sure that this can be enforced, we still have a lot of shortcomings. It's easier in terms of the bigger industries where, I mean, you know, because we have also enforced that the food must be labeled. But when it comes to, you know, not the pre-packaged, but the prepared food, you know, in restaurants, in the takeaways, and especially in the informal sector, those I mean, the level of enforcement is really not very good. So we do have the regulations, but the enforcement is not, you know, up to scratch. Those are the areas working together with local authorities, your environmental health practitioners who should be employed by local authorities to enforce those regulations. Those are the areas which we still have weaknesses. But we would like really, I mean, to rely a lot more on health education, because there's a limit as to how far you can go in terms of enforcement. But, you know, when people themselves become much more conscious and actually get convinced that it is for their own good to avoid a certain kind of foodstuffs. That will go a long way and become much more sustainable.
So in terms of scaling up now, since of course you are seeing these type of numbers, what are we likely going to see in terms of interventions?
Well, on the one hand, I mean, in terms of, so we're looking at reinforcing in the area of prevention, improving on our messaging, as I said, using various forms of media, trying to adjust with the time, move with the times in terms of the dominant media, but also in terms of at the community level. We do have a cohort of community health workers who are training to be able to move also into homes with digital blood pressure machines and also digital measurements of blood sugar, talk to families at home and check their blood pressure and also check the blood sugar. But to also add to that, we can't only rely on people who are in a way employed. We also trying to make sure that amongst others, for instance, traditional health practitioners, we're working with the associations of traditional health practitioners to encourage, in some areas, there are some traditional health practitioners who have already been trained also in using these gadgets and being able to then refer and know that if you put, this is how you measure blood pressure, this is how you prick a finger and get a blood sugar, and if it's outside these numbers, then you need to refer to the nearest clinic and the nearest hospital. So those are some of the measures, and that's why we're saying, learning also from the COVID, we're saying that to deal effectively with the non-communicable disease, you need to improve on the health education, communication, but also involve all of government, basic education at the schools, basic education, and also higher education at tertiary levels, but also all of society at traditional authority level, traditional healers, community organizations. So that's really how we want to move in to get people more educated and be able to test, to screen, to test, and so that anytime when somebody there's a sign that something may be going wrong, we must be able to refer them for treatment, roll out the treatment before it gets complicated.